a group of eye diseases, really, where you get characteristic damage done to the optic nerve. And normally you get this appearance at the back of the eye called optic discoupling. And it's normally associated with damage to the visual field or damage to your blind spots. Sometimes it's associated with high pressure in the eye as well. But essentially it's a blinding disease, and that's why it's important to pick it up and manage it appropriately. It's a very good question. Generally, it's patients who have a strong family history of glaucoma. So if there's a first-degree relative, that's a significant risk. And generally, it's a disease of age. So the older you are, the more likely you are to get it. As an example, about 1% of the population have it at the age of 60, and that increases to 4%. So it really is an aging disease of the eye. Well, a patient may not notice anything at all, and that's the first thing to say. It's almost like the thief of sight. If it affects both eyes, then it's more likely to cause some visual disability, and patients may notice some difficulty in their vision. If it's very advanced, it will cause narrowing of the vision, and you may get tunnel vision or areas of blotched vision. But normally, by that stage, it's quite advanced, and that's really why patients are encouraged to see their optician and have regular screening, because it effectively is a disease that's very quiet, and you don't know you've got it. There are ways to prevent glaucoma, and it needs to be monitored and picked up. And if we think someone is developing glaucoma, if you address it by treating the patient appropriately, you can often prevent any sight loss completely. Normally, surgery is the last option. Normally, the first treatments that we offer are either eye drops. The treatment of glaucoma is to lower the eye pressure, and that can be treated by using eye drops or laser treatment, and that's generally the first line treatment. If that doesn't work, there are more eye drops you can take, or even tablets, and normally surgery is reserved for the more severe cases where the other treatments haven't worked. Yes, I mean, it's important that you take your eye drops every day, because if you don't take them every day, then they become less effective. The way the eye drops work is they lower the eye pressure, and you have to take your eye drops for the pressure to be low, otherwise the pressure will build up again and can potentially damage the nerve behind the eye. So it's really important that you take the eye drops on a daily basis. It probably won't harm your eye, but what we have to always remind patients is that actually one eye drop is enough. The concentration of the eye drop is such that it will seep into the eye and be effective. If you forget your eye drops, we always say, don't worry, take it when you remember the next available time, and it will still work. Even when people forget their eye drops, the drug is still in the system, and it can work for up to a month. So it's not disastrous if you forget your eye drops, but obviously it will become less effective if they forget to put them in. It's really important to come for regular checkups, because we need to see whether the treatment that we've given you, or even if we're just observing you and watching, that nothing is changing or deteriorating. And the only way we can do that is through regular checks. Normally, when you come back for checkups, you normally have a few tests done. Normally that includes a visual field test, which is a test where you sit in front of a machine and it plots any blind spots in your vision, or what we call an OCT scan, which is optical coherent tomography, and that's a clever laser that takes a picture of the back of the eye and tells us whether there's any damage done to the optic nerve. And through these tests we can establish whether things are stable or changing.